standards, right education system.
I'm the former Frank Key.
But the Northwest pass, we really need somebody different.
Your career, you're used to winning. Life, it was everything to us. 7 or 8 weeks of two-a-days.
They really make me appreciate
We're allowed to win.
he's coming in and we'll be shooting the whole time.
Let's go back real quick to the Enid Walk of Fame.
And of course, we have training in confined space.
Legitimate, maybe to know a little more.
A good safety tip on that, Steve.
Putting our hat on and getting out there and doing the job.
The television model that you watched growing up.
Houston, this is the International Space Station.
City Connections begins right now.
Hello, I'm Steve Kime with the City of Enid. Welcome to City Connections, our special edition on your health today. You know, over the past several years, we've had a variety of individuals visit the Enid Television Network studio, and we've talked about like CPR, depression, how to battle colds and flus, and just really a variety of health topics, if you will. Well, today we have a very special guest, came all the way up from Oklahoma City to visit us today here in our studio to talk about pain management. And I think we all can relate to, we have aches and pains. My special guest today is Dr. Blake Christensen, and we'll talk a little bit about his credentials, if you will, to set the stage for our visit today on your health. And again, our topic is pain management. Dr. Christensen is from the Deer Creek, Edmond area. He received his undergrad degree at the University of Oklahoma with honors. I need to throw that in there. Wrestled at the University of Oklahoma. Doctor of Osteopathy degree from Oklahoma State University. Residency in anesthesiology, tough word, at OU Health Sciences Center. And he also completed the ACGME approved fellowship in interventional pain management in Chicago, and also is a board certified in interventional pain management. If you would, welcome to the Enid Television Network studios, Dr. Blake Christensen.
Hey.
Dr. Christensen, good to see you. Thanks for being with us today. Well, right off the bat, the older I get, maybe the older that you get, it seems like more aches and pains show up. Is this what we have to face? Is this the normal way of life?
First of all, I like to call it, I always tell my patients, it's not age, it's wisdom and maturity.
Okay.
It's part of the normal process, and sometimes as we get older, we get more aches and pains just because our bodies are changing, specifically, you know, in their spine. You know, you get a little bit more arthritis, your discs desiccate or dry, and they change the shape a little bit as you get older, and all that can have negative impacts and make you feel certain types of pains. They're not all equal. Some hurt more than others, and you don't always know what causes it, but yeah, you can wake up one day and have a completely different pain than you had, you know, the day prior.
I think one of my frustrations is I've been active really all my life. And I had this mindset from a kid all the way up through current age, if you will, that if I stay active and I'm doing stuff, I won't have any aches and pains when I'm older. And then I get these aches and pains and I go, wait a minute, I didn't sign up for that. I've been active so I wouldn't have that. So I guess it was this false narrative in the early days of thinking that, well, if you stay active, it'll help you out in the long run. So
That's generally true. I mean, the best thing you can do is be active. The more active you are, the stronger you are, you know, outside just your skeleton. If, you know, 80% of your body weight is held on your axial skeleton, your disc, your vertebral bodies, you know, the other 20% is held by your muscles and gives you the infrastructure. If you keep that strong, it's less weight that, you know, your disc and your nerves, or your disc and your vertebral bodies have to carry. So, you know, in essence, you want to keep being active because that's the best thing for you.
Okay.
But
That's
there's always
encouraging.
bumps on every, you know, road, and yeah, everybody always hurts a little bit, you know. At a certain point, you know, a 2 out of 10 level of pain might be normal. But, you know, it's about being functional and continue to move and not having the pain affect any activities of daily living.
Yeah. So I guess what you're saying is that you're really in trouble if you have pain that prevents you from living. You know,
Exactly.
You just kind of have to adjust and go forward. Well, we all know what pain feels like. Aches and pain from head to toe, whatever. But give us this definition, and I haven't really given it much thought. What is pain? I know what it feels like, but I don't know if I could write out the definition.
The definition is argued, but you know, the most common definition of pain is it's just an ominous warning sign to yourself that something bad in your body is happening or has happened. So it gives you a chance to change something you're doing, to seek treatment if it is affecting activities of daily living, and try to improve and change lifestyles from it.
Very good. Well, let's go back to the beginning, Dr. Christensen. What factors influenced you of wanting to be a physician, to be a doctor? Does it go back to your OU wrestling days of aches and pains, or what? Let's go back to that beginning.
Well, I mean, back when I was even younger than that, elementary school, middle school, my grandpa was an osteopath.
Okay.
He went to the 3rd class up in Pennsylvania, PCOM, and graduated from that school of medicine. Then he moved down here and practiced in Tulsa, Oklahoma. So I'd always been looking to be an osteopath when I got a little, when I was applying. And it just worked out. I mean, it made sense, and I always kind of kept my eye on the goal and studied hard, was meticulous with, my studying habits with wrestling, and kind of focused the whole time. There wasn't any doubt that I was going to be a physician. I didn't necessarily know what kind. I knew I wanted to have something to do with the musculoskeletal system, and so, I kept that in mind and kept focused and kept moving forward.
Let's talk a little bit about your days wrestling for the University of Oklahoma. Dr. Christensen, we've had former NFL players on the show that have graduated from Enid High School, and they went on to have professional careers. And we've had other individuals, a gentleman that you know, Chance Leonard, wrestled at OU, and also from my hometown of Perry. Those experiences wrestling at OU with making weight and just the discipline and working hard and dealing with the aches and pains and playing through things, if you will, how does that impact your role as a physician today? Does it put you on the side that you understand what pain's like?
Yeah, it does.
Or aches?
The aches. Wrestling, I mean, it taught me, a work ethic, and it taught me, how to lose, essentially. In wrestling, you're standing out on a mat and kind of, battling it out for yourself. You don't always win, but you need to learn how to lose and then learn how to improve from that. In medical school, the daily studies and just the things that you face, you have to learn to persevere and keep moving forward. You're not ever always going to make the grade you want to make, but you need to know how to improve and get better from it. It's definitely helped me with medicine and moving forward, and facing the obstacles every day. So it's it's a pretty tight-knit community too, and so when you get to college, it's just tenfold what it was back in high school. So you definitely learn to improve and learn to work a little bit harder than what you're used to.
Very good. My special guest today on City Connections Your Health is Dr. Blake Christensen. Dr. Christensen came all the way up from Oklahoma City to discuss that key topic that I think we all can relate to about pain or pain management. Here's the next question. Dr. Christensen, if you're speaking to a patient and someone is watching the show today and they said, boy, I tell you what, I've got this pain or this ache in my shoulder, my back, my knees or whatever, and it just doesn't seem to go away, because they were patient thinking, okay, in a couple of weeks it'll go away. When is it time for an individual to see a physician in regards to pain management?
It's time when it starts affecting all activities of daily living. When you're finding yourself sitting at dinner and you can't focus on the conversation because your neck hurts too bad. When you start feeling a pain radiating down your arm that doesn't go away after a couple weeks of conservative treatment, over-the-counter medications, and talking to your primary care doctor. Not every backache is the same. So you really kind of need to keep an eye on it, evaluate it, because some of the aches can turn into chronic pains that you can't really get relief from unless you do small spine surgery, spinal cord stimulation, which we do, that actually blocks the nerve from the pain from going, traveling up your spine and reaching your brain. So there's a bunch of different procedures we do, but we always want to try to do the conservative, easy ones first.
Very good. Well, speaking of easy, when I think of, say, some kind of help to pain management, to me, I think of massage and maybe acupuncture. What role, if any, do those two avenues, if you will, if I can call them avenues, play in pain management?
Alternative treatment modalities are always great. It's always a good idea. Acupuncture has been around for 5,000 years, so there has to be something to it, and people do get relief from it, so it's worth trying. In our office, we always stick with the FDA-approved treatment modalities, the ones that have been proven, via the big studies, the meticulous studies, to give a positive role and help patients return to, their normal functional lifestyles. So with that, we do epidural injections. We do radiofrequency ablations where we can actually treat arthritic pain by burning the medial branch of the nerve. That lasts for 6 to 14 months, and we can do that all the way up from the back of the neck down to the sacrum. So it essentially can help with arthritic pains on the entire spine.
That sounds kind of nervous to me when you said burning something.
Yeah. The nerve that we're focusing on is about the size of a kite string. It's just a sensory nerve.
Wow.
So if you burn or ablate that nerve, you don't feel the pain in that area. It doesn't mean that it's going to affect anything allowing you to move or affect sensory elsewhere, but it just helps you not feel the sensory from the arthritic pain.
So if you have any, say, back pain or whatever, can a massage in the back area, could that aggravate things? Or does the massage part, is that draw blood to that area? I'm trying to understand the role of how it seems like you can kind of loosen up from a massage.
Yeah. A massage will just loosen up the muscles.
Okay.
If the underlying issue is a disc that's pushing on a nerve and really irritating that nerve, massage might help for 30 minutes and then the nerve will become irritated again. It's all about finding exactly what the pain generator is. Not all back pain is created equal.
Interesting. And the pain generator, for us in layman's terms, can you explain what the pain generator, what you mean by that?
So if we're looking at the spine, you can look at the posterior column and you can look at the facet joints. The arthritis can cause a deep nagging pain in your lower back that essentially just stays in that area, maybe travels down the back of your leg, stops at about the knee. If you move forward and you're at the middle column, you can have the nerves that's getting pinched by a disc pushing forward, or as the neural foramen gets a little bit more narrow, it can impinge on that nerve root and cause pain that radiates down your leg. That's a different type of pain, more of a sharp stabbing pain, something that radiates down past your knee. Sometimes if the nerve is pinched, it can affect weakness and you'll have trouble walking. And then you can have pain further anteriorly at that disc or at that vertebral body. If you're osteoporotic and you have a compression fracture, we do kyphoplasties and we can go in via a little needle and put a balloon and re-elevate the vertebral body and restore its anatomy. And we put bone cement in there that hardens and creates essentially an internal cast for that vertebral body. The patients leave, that day after that procedure.
Impressive. Well, I caught half of the conversation based upon the verbiage that you were using, but it all sounded good. Let me ask you this. During the time that you've been practicing, and you were just talking about the balloon and the other things that you mentioned, but during the time that you've been practicing, what are some advances or medical advances that have just taken place, say recently, that maybe X amount of years ago wasn't done, but today it's more prevalent or something? Because I'm sure with technology, with computers and the different machinery, treatments have really moved forward.
Yeah, the spine treatments are moving forward on almost a daily basis. Now we're doing spinal cord stimulation when people have a chronic back pain and chronic pain radiating down their leg, or they had a back surgery and they're still having pain from it.
Okay.
We can do treatments where we use devices that will essentially block the pain from going from their back or their leg up to their brainstem so they don't feel it. It doesn't register, so they can have a break from their pain. But that device, now they're coming out with higher frequencies that block the pain in a different way. Now we're doing more radio frequencies where we're treating arthritic pain in the knee. If you had a painful knee surgery and you're still having issues from that, we can go and zap those nerves right there and essentially not have to look at doing another total knee surgery, but stop the pain from there. And with that, we can decrease medications. So what I do is I usually do more interventions. I'll do some med management, but we are trying to decrease the narcotic use to kind of combat that war in itself.
Okay.
And we can do that, hip ablations and zap those nerves too.
We need to take a short break, but before we do, I asked Dr. Christensen, I guess if you had asked 10 different individuals about the use of chiropractic care, you might get 10 different responses, say, yeah, it's perfect, nah, I don't know about this, whatever. But from your perspective, what role can chiropractic care help in regards to pain management?
It works hand in hand. If the pain generator is deeper around the disc, around the nerve root, we can do injections to put the medication exactly where it needs to be. And the chiropractors can also help kind of calm down the nerves around it. by using different, manipulative therapies to kind of calm down the nerves, calm down the muscles. So they work hand in hand. It's definitely worth seeing a chiropractor if you're having some issues. When things don't respond, or if you just want to try something different, then there's plenty of treatment options out there.
Very good. Our special guest today on City Connections Your Health is Dr. Blake Christensen from Oklahoma City, and ventured up to the Untitled Television Network today to just share with us his expertise about pain management. And we'll have more with Dr. Christensen right after this. Welcome back to City Connections, the special edition of Your Health, and our topic today is pain management. Thank you for being with us and staying with us today. Again, my special guest to share his expertise in regard to pain management is Dr. Blake Christensen from Oklahoma City. Dr. Christensen, when the pain doesn't go away, I guess it might lead to, I think if I have an ache that doesn't go away, it's just frustrating to me. Maybe it's irritating, it's frustrating, but I guess it could lead to maybe some type of depression or anxiety. I mean, I guess it could really push back past frustration and really impact a person's life. So as a physician, if somebody's watching this, said, I've been living with this pain a long time, and I'm so tired of it. I'm frustrated. I'm just kind of down. What would you say to that individual?
I would recommend seeing an interventional pain management physician and figure out what the exact cause is. Pain can cause anxiety. The nerves in your neck. When I hurt my neck doing the kayaking stuff downtown in Oklahoma City, I tried medications, tried trigger points, and it didn't work. So I had an MRI, and I asked one of my friends that I work with if he'd give me an injection. But the pain was radiating right down into my chest and radiating down between my shoulder blades. It wasn't the typical pain that was radiating down your arm, but it hurt. I mean, 5 weeks of not doing anything, of going to dinner and, sitting there not being able to concentrate on the conversation because you couldn't find a position that, took away the pain. So, go see someone, seek care, and figure out what the exact cause is.
And I appreciate that answer because I think maybe in my own life and other individuals that I know that are very active, we have this mindset of we're going to work through this. We're going to be patient. We've always dealt with pain, and we've just, by golly, I'll just work through this. And then it gets to after 3 months, 6 months, a year later, you're thinking, oh, it's never going to go away. And it really could have that impact. So I appreciate your response to that. Let's talk about trends, or maybe the type of patient that you see in regards to pain management. Is it from age 10 to a 100? I mean, is there just all walks of life that people come to see you in regards to pain management, or any physician in pain management? And is there a particular ache? Is it the back? Is it the knees? So what is out there, I guess, is my question.
We see about everything in our office. Age, I think we usually try to treat adults 18 and up. I think one of my oldest patients was 103. So, all walks of life. The pain can come from anywhere. People don't always, understand where the pain's coming from. Sometimes the patients come in with a foot pain. It's in a specific toe. Well, it's not coming from your toe. It's coming from your back, and the pain can be radiating down a nerve, and specifically, you feel at that specific spot. So, sometimes those patients are referred in from a podiatrist that will see them be looking at their feet and say, no, this isn't a foot pain. It's coming from your back. So, we see about everything. It's our job to diagnose, and if we don't, we work closely hand in hand with a bunch of different specialists that can help determine what it is, or we get imaging that, MRIs, x-rays, things like that can help.
I think that was very eye-opening to me through the years, is that if the pain was, say, coming out through my elbow, I'm thinking there was something wrong with my elbow, but it was enlightening to know that, no, that may be the end result, but it's starting somewhere else.
Yeah.
And I think a lot of people just say, well, if this hurts, that's where it hurts. Well, yeah, that's where it's ending up, but it starts. So I guess this network of nerves, I guess it all starts in the spinal cord then, and then just goes everywhere, right?
Yeah. Yeah, the spinal cord, has a a number of different parts. The pain can be coming from a number of different areas. So that's why they have specialists that just specifically focus on the back, on the spine. And that's predominantly what we do. We do look at the knees, the legs, the feet, but we're specifically, focused on the spine and kind of work from there.
Well, Dr. Christensen, I'm always looking for my next meal. I enjoy eating, but we were talking off camera a little bit earlier today about, are there specific foods? There's proteins and things of this nature, but there's probably isn't really any study out there. But if somebody's watching this show saying, well, I wonder if I should be eating more of so-and-so foods, jokingly, you said that you should eat certain types of pizza, but I guess there's not really any results of studies out there that show eating particular foods help in pain management.
Yeah. When it comes to food and diet, it's almost preventative medicine at that point. You want to eat foods that can be healthy, that can, prevent you from gaining weight, so you can stay active, keep fit, and that's in turn how you can improve, your back, your health, and your overall, functionality. I don't know of necessarily any food that has more antioxidants that calms down the nerves. You can look and research that on your own, but if you think cheese pizza helps with chronic back pain that radiates down your leg, then
order 2 of them.
Yeah, order 2 of them, but I wouldn't do that every day.
Yeah.
So
years ago, there was a physician when I was very active in running. I would team up in the mornings and run with this particular doctor. And his view on vitamins was really interesting to me because my wife is all about vitamins. And I didn't even take one a day. So I just wasn't taking any vitamins at all. And the doctor friend that I would train with, he said, oh, Steve, vitamins don't really have a role. He goes, if you eat right, you'll be good. That's what he always said. Mm-hmm. And then I've heard other individuals say, oh, you need to take vitamin E and D, and the list goes on, kind of deal. When it comes to pain management, do you know or are you aware of any role that vitamins can play? Or is it just kind of the same thing with food? It's kind of the preventive part, I guess.
Yeah, as Americans, we already have a pretty well-balanced diet. Most people eat when they're hungry and they eat what they want to eat. At that point, if we eat healthy, we're going to be getting all the vitamins and the minerals that we need. So it's kind of catch-22 in itself. You can eat what you want, but you want to eat healthy. I don't necessarily know of any vitamins or food that are going to improve health or lifestyle, but a dietitian would be a good person to talk to, or seeing your primary care physician would be a good starting point.
Very good, and we'll take that advice. Before we take our next break, we'll have a question for Dr. Christensen. Earlier, when I was saying that I was doing all this active lifestyle so I wouldn't have all these aches and pains later on in life. Let's revisit that just for a little bit, Dr. Christensen. The key role to being active and to have this active lifestyle, if you're 50, 60, or 104, like your one patient, mm-hmm. What is the key the key benefit from having an active lifestyle?
Being active will allow you to kind of be up, moving, staying functional, and that's kind of our goal when we refer patients to physical therapy or to chiropractic care. Is get up, move, learn how to strengthen your core, do things like yoga that can specifically strengthen your core and get you up moving. The less weight you have on your axial skeleton, the less weight that's carried on that disc, the less weight, less you have kind of pushing on that nerve root, causing pain to radiate down your leg. And as far as arthritis, if you can be active and mobile, that joint's not going to continue to get arthritic and inhibit your movement in your lumbar spine or your neck. So an active lifestyle is the key. You're exactly right. You want to keep moving, being active. Don't exert yourself. Don't walk around carrying 100-pound dumbbells and trying to do all sorts of crazy lifting techniques, but be up, moving, kind of pushing yourself.
Very good.
Let pain be your guide.
Okay.
What I like to say.
I like that. Let pain be your guide. That's the word for today, or the slogan for today. My special guest on City Connections Your Health, Dr. Blake Christensen. We'll have a final question for Dr. Christensen right after this. Thank you for staying with us. Welcome back to City Connections, Your Health. I hope you've enjoyed our topic. As you know, throughout the years, we've always tried to provide a variety of subject matter of interest to you, the viewers. And I certainly appreciate Dr. Blake Christensen coming up from Oklahoma City to talk to us about pain management. Dr. Christensen, let's go back to a question I asked you earlier. You know, when is it time for someone who's been dealing with pain for them to go see that doctor? And your best response is?
You know, when it's time when you're sitting at home on the couch and you're still feeling the pain, when it's beginning to affect all activities of daily living, and you think of it, you know, throughout the day. When you have to go see your family physician, and he might write you for different, you know, opiates or other medications to dumb it down. Well, that's when it's time to see a pain management physician to figure out what the pain generator is, and then to treat the cause. That way we can get you off medications and out functioning on a daily basis where you're normally at.
Dr. Christensen, we only have a couple of minutes left. Let's talk about that key word you shared, opioids, just a few moments ago. In your role as a physician, and maybe you can't speak for all physicians in Oklahoma, but as your role, how are you addressing this? And some people call it an epidemic. But.
You know, in our office, we manage pain patients all day. We have to do it safely, so we're using things that the governor put in place with our physician monitoring program. So we can pull up and check where patients last got those medications, how many they got, and so we know if we do, you know, right for them, we need to be decreasing them, treating the cause, and making sure they're doing things that do help them. Physical therapy, acupuncture, chiropractic care in conjunction with what we're offering. It's all about treating the cause of the pain, and we don't do any justice to anybody just covering it up and blanketing a problem.
Doctor, this has been very informative. Thank you for your time today.
Thank you.
This has been really good. Appreciate it. And thank you for joining us today here on City Connections, Your Health. Our special guest is Dr. Blake Christensen. You see his information on the screen. And so, as he said, if the pain is so disruptive that it just really impacts just life in general, that's the time to reach out for help. So thank you for joining us today on City Connections. I'm Steve Kime with the City of Enid. Until next time, make it a great day.